Hi guys, here's Paula, the crazy ozone lady from the Power of Ozone, and in this live stream I will give you the latest news about which countries have allowed ozone therapy for COVID-19 or the coronavirus infections. So first of all, I have to admit I'm a little nervous because I'm not that well prepared because there have been some news that I noticed on the last minute. Okay, now someone is drilling here right now. Let's see what we will cover today. So yes, ozone therapy has been used by various countries, by various hospitals in different countries on coronavirus patients, and this is really, really exciting news for ozone therapy because, as some of you may know, ozone therapy in many countries is illegal in the sense that many ozone doctors are allowed to treat it, just like many other alternative treatments are legal, like, for example, homeopathy or vitamin infusions. So doctors are allowed to use those treatments, but they're not allowed to make any claims about it, and those treatments are not really authorized or approved by medical authorities in most countries. So ozone therapy is kind of regarded as like a bogus treatment that yes, doctors can do this, but no one is using this in hospitals, and there's as good as no health insurances that I know of that cover the costs of ozone therapy, only very, very few exceptions. So now we're seeing that actually ozone therapy in some countries has been used in hospitals officially and on a larger scale. And so this is really unprecedented. So let's see like which countries, where has this been done, and what am I talking about? And so what I will mostly rely on is my article on my blog, which I wrote on the topic, which countries use ozone therapy for coronavirus infections. And so the first country that I look at is Italy. So something really special has been happening in Italy. So basically right now there are around 15 hospitals which use ozone therapy on COVID-19 patients, at least according to the Italian Scientific Society of Ozone Therapy. And this society, SIOT is the abbreviation, they have posted a number of reports already on their work on coronavirus infections and ozone therapy. And so this was the second report. No, I'm sorry, that was the first report. So let's just jump to the second report that had 73 cases of people with coronavirus infections, and that was published, I believe, in I don't want to say anything wrong, I don't know exactly. Here it says at the end of April, 24th of April. And so yes, so this is a report about 73 patients who were hospitalized because of a coronavirus infection. And they were treated with ozone therapy, and the form of ozone therapy that was used here was the major autohemotherapy. So around 100 or 200 milliliters of blood was drawn, and it was mixed with equal amounts of ozone oxygen gas at a concentration of, I believe, 40 micrograms per milliliter, so kind of like a medium concentration. And they have seen quite good results. So they were able to extubate, so remove the intubation of 15 of those originally 24 patients. So originally 24 patients were intubated. After the ozone treatments, only 15 of those 24 were extubated. So they improved to the degree that the intubation could be removed. And at the writing of the report, 5 were still intubated. Then there were also 10 which were completely cured, and the tests came out negative. So the COVID-19 tests. So, but it's not entirely clear whether all of those 10 were originally positive on a test and then turned negative, or whether it just was found after the ozone treatments that they were negative. And this has actually received quite some press in Italy, all those ozone treatments. And then there's another Italian society of ozone therapy. So there appears to be two major ozone societies. And this other ozone society, they also issued a report where they treated 36 COVID-19 patients with ozone therapy, and only one of those 36 needed to be intubated after the ozone therapy treatments. And so here you see I made a kind of like a collage of the press that ozone therapy has received in Italy. So this is all in Italian. So this seems to be a much more accepted treatment, and something, what's been happening with ozone oxygen therapy in Italy is just in general much more tolerated than other countries, it appears. And another example, a good example for this is, I cite this case of Claudio Pedrazzini. He is a member of the Italian parliament, so he's a politician. He was diagnosed with COVID-19 and he recovered with ozone therapy, and he published this on his Facebook page. So this shows that ozone therapy in Italy seems to be much more accepted than in other countries and is not regarded as much as a bogus treatment. And when you also go on, for example, the Facebook page of the Italian Society for Ozone Oxygen Therapy, and you read the comments of the people, there's so many comments of people who report, oh yes, I had problems with my back, I had problems with pain or a bulging disc in my back, and I received ozone therapy and it helped tremendously. And it's like many such comments. So it's very much possible that in Italy ozone therapy is actually in a much wider use than right now in any other country in the world. It's possible. But okay, now something that is a little bit discouraging about this Italian society, where there's about this Italian situation, there's actually two things. So it appears that this whole trial, so the fact that so many hospitals in Italy are using ozone therapy on COVID-19 patients, it appears that this all hinges on a misunderstanding between the ESS, so the Istituto Superiore di Sanità, which is a branch of the Italian Health Department, and this Italian Society of Ozone Therapy. So this branch of the Italian Health Department wrote a letter to CIOT, and CIOT apparently misunderstood that letter as an authorization to perform those ozone treatments in hospitals. And this was later than another branch of the Italian government, which is also responsible for some health issues, for some health department branch. Is it? They actually clarified the situation and said that ESS is actually not able to give any such authorization for people to start performing experiments. So it appears that this whole intervention, this whole thing that is happening in Italy is legally on a pretty shaky ground. So let's just hope that after this whole thing concludes that they will not get into any legal trouble. But yeah, so this is the situation. And another thing that was recently published, this is the most recent report from the CIOT. And let me see that I find the right, no, that's not right. Okay, this one. So this report here, so this is the latest one from CIOT. Okay, I cannot see. Okay, this is from 15th of May. And so one thing that they did here, which is really interesting, is they actually compared the outcome of ozone therapy on COVID-19 patients with the standard therapy, although it's not clear like what the standard therapy consisted of, like which drugs were given. But so at the first sight, the numbers seem pretty interesting and seem to favor ozone therapy. But when you look at a little closer on the numbers, there are many things that seem, well, I think the best way to describe this is a little shady, and it appears that the ozone therapy has cherry-picked some data. So what do I mean by this? Now, I don't think you guys can actually see the cursor, the mouse that I'm using. But so here, when you look at the table, so there is on the left side, there is the group with people who have been treated with ozone therapy, and there were a total of 40 of them. So those were coronavirus patients, 40 coronavirus patients who received ozone therapy. And on the right side, you have also 40 different patients which also were sick with coronavirus, and they received this, not clear what it was, but like some type of a standard therapy. And then different measurements were taken, and they were compared. So now first, it was also each group, their values were first taken, their measurements were first taken before the treatment started and then afterwards. And so the ozone therapy group, for example, when you look at the temperature, so the medium temperature of those 40 patients before the ozone treatments was 38.7. After 3 to 4 ozone treatments, it was reduced on average by 5% to 36.5. And then when you compare this to the standard therapy, they achieved only a 2% reduction. So, which is great because, of course, one of the problems with coronavirus infection is the fever that people experience. So it shows here that ozone therapy was more effective at reducing the fever in coronavirus patients than the standard therapy. Next thing, they looked at glycemia, which I assume they mean blood sugar. And here is where it gets a little shady, let's say. So you see with the ozone therapy group, the first value was 300. So this was the average value of those 40 patients, 300. Which, by the way, is extremely high for blood sugar. So I have a hard time believing that this is a real value, because those people, they should have been at a hyperglycemic shock. So, but anyway, so it says here 300. And then it says that after 3 to 4 ozone treatments, that was reduced by 50% to on average 150. Now, when you compare this to the standard group, you see that the initial average number was 171, which is much more realistic. 171, this is much more realistic, although it's still very high. And then after the standard treatment, it was reduced by only 25%. But now when you compare the before values between the ozone therapy group and the standard group, then you see that it appears that it's clear, not appears, it's clear that the people in the ozone group had much higher initial values. So it was reduced by 50%, they claim. Yes, but they had already much higher values. So it looks like either patients were cherry-picked to the ozone therapy group with much higher blood sugar levels to make it look better, or those are just fantasy numbers. And I think both is possible, because a blood sugar of 300 is, I think, astronomical. And it continues similarly, like next is creatinine, and you see the average before number in the ozone group is 3.5. The average before number in the standard group is 1.27. Now, how do you explain this? So the average before number of creatinine in the standard group is 1/3 of what was in the ozone group. So how do you explain this? I think you can only explain this by either cherry-picked data or just fantasy numbers. And another reason why this could be fantasy numbers is because when you look for example, for lymphocytes, which are lymphocytes, in the standard group, then you see decimal points. So it's uneven numbers like 15.48 and then 21.38. And when you look in the ozone group, there are no decimal points. They're just absolute clear numbers like 15, 30, bam, bam. So no decimal points. So I think they cherry-picked a little bit those numbers to make the ozone group look much better. So this is, I don't think that this is credible. So this is really unfortunate. And so the authors of those reports are the president, one of them, his name is Francini, who wrote those reports, and now they also they conducted other studies, which I also talked about on my blog, about dysbiosis, and also another study where they compared major autochemotherapy with rectal insufflations in the treatment of a condition, or a certain metabolic condition. I forgot the name what it was. And I also looked at those studies, and the studies also looked very cherry-picked and too perfect, and I wrote about it, and I said this is something not right here. And so this here, what they published, this only confirms my suspicions that, unfortunately, as much as I admire their chutzpah and their courage to go ahead with that trial in the hospitals with the ozone therapy, I think they're not delivering here clear information, and they may be playing around with the numbers here just to make ozone therapy look better. And this is really unfortunate, because I don't think that ozone therapy needs such cherry picking. All right, well, let's continue. So next country is Spain. So a hospital on the Spanish island of Ibiza, I'm probably butchering completely the pronunciation. So they have also seen successes on COVID-19 patients. And Dr. Alberto Hernandez, the assistant physician, he described the results with ozone therapy on coronavirus patients as spectacular. And also, we also have Dr. Olmedo. I also talked about this in another article that I published on the topic. Dr. Olmedo is that brilliant Spanish oncologist who has been treating himself with what he assumed was a coronavirus infection. He then performed a test, and the test turned out negative, but he is convinced that it was the ozone therapy which turned him negative. And he was posting about this on his Facebook page, and he laid out very convincingly why what he was going through was most likely coronavirus infection. And he successfully treated himself with, among others, DAV, direct ozone injections, with rectal insufflations, and I believe also the TANPAS. So those are the news from Spain. Now, what about USA? Does the US treat coronavirus cases with ozone therapy? Unfortunately, not. There is no such program. There are no such plans that I'm aware of. Well, there is one hospital. It's called Larkin Community Hospital in South Miami, and they are planning to start a trial on COVID-19 patients with ozone therapy. And they told me, I contacted them, and they told me that they submitted, they asked for approval by the FDA, or they're in the course of submitting an application to the FDA, but they have not done that yet. And Larkin Community Hospital, this is the same hospital that actually had posted a YouTube video of them filling a syringe with ozone on a longevity machine, and the video was titled Ozone Therapy for COVID-19, and then it was unfortunately taken down. but this is the same place. But when I asked them if they were already treating patients, COVID patients with ozone therapy, they declined. So I'm not sure whether they said that to protect themselves or whether this is in fact the case. Other things in the US, so there are of course single private doctors who have been treating their patients with ozone therapy. Among them at the beginning were Dr. Robbins or Dr. Rowan. They published actually a call, Dr. Rowan published a call on his Facebook page where he encouraged COVID-19 positive patients to contact him and Dr. Robbins, and he said that they were willing to treat coronavirus patients. But it appears that once some crackdowns started on ozone doctors who were treating or claiming to treat coronavirus patients, I think that this offer has been retracted. So we don't know if this call actually resulted in any actual treatments, any successful treatments. And there was actually Dr. Brownstein, Dr. David Brownstein. He is the man who has administered a number of intramuscular ozone injections and who was also recommending hydrogen peroxide nebulizations and nebulizations with iodine to his patients. And he had also posted a number of videos on his YouTube channel where he presented successful cases where those treatments led to a resolution of symptoms in those patients. But unfortunately, he got contacted by the FTC, so by the Federal Trade Commission, and they asked him to stop making any statements about treatment protocols of vitamin C, C and D, nutritional IVs, ozone nebulization to support the immune system with respect to coronavirus disease. So since then, his entire YouTube channel has been either taken down by YouTube or maybe Dr. David Brownstein decided to close it himself, and he also purged his blog from many interesting posts where he was actually talking about successful treatments. But I have actually taken screenshots of this because I was actually expecting, I thought it may be possible that something like this would happen. And so I actually took screenshots of some of those stories, which are now have been purged, but there are still screenshots of people reporting they've been successfully treated with ozone therapy for what they either believe was coronavirus infection or maybe it was even a confirmed. And one of them was here, Dr. Brownstein's patient, you see. So this is a screenshot from a video which now has been taken down. But there was just one of many other videos that Dr. Brownstein had about ozone therapy and coronavirus infections. So I assume there are many more. I'm sorry that I'm scrolling here like wild. Okay, here, this is where I wanted to go. So there are probably many more ozone doctors who have treated their patients with ozone therapy in their practices, but just have not been publishing this, have not been posting about this, but most likely, we know this for a fact because if you check the Ozone group on Facebook, there are some comments from doctors, from alternative practitioners who admit that they have been treating, and very often successfully, patients who they either assumed, speculated that they were coronavirus positive, or where it was confirmed that they were positive. Okay, so another country here is China. So there was this one video on Facebook, very short, I think it was less than 1 minute long, and it showed doctors clad in this, you see, type of like a hazmat suit, and they were using the Herman green machine, which is of course an ozone generator, and they were shaking blood in either a bottle or a bag. So they were performing either major autohemotherapy on them or even a TAN pass. So this, and here you see also the title, Coronavirus como Ozonioterapia. This is either in Spanish or Portuguese, I'm not sure. So it appears that yes, at least one place in China is using ozone therapy on coronavirus patients, and this then has also been confirmed. Here I have obtained this is a letter from the Tianjin University in China. Now let me show you a close-up of this. Okay, just a moment. This doesn't mix. Okay, this is a close-up. No, I'm sorry. I think it's better if I do it the other way around. So this is the letter. So this letter was sent to Italy, to an Italian doctor, and from a Chinese university, from a medical college of Tianjin University, where they were treating coronavirus patients with ozone therapy. And they say we did make some progress in treating COVID-19 patients with the ozonated autohemotherapy. And then they continue to say that many symptoms like dyspnea, severe cough, chest distress, and asthenia were significantly improved. Especially the critically ill patient was recovered from ARDS, which is, I believe, acute respiratory distress syndrome or something similar, without using either invasive mechanical ventilation or ECMO treatment. I don't know what ECMO stands for. So in all, they have treated 4 patients, and they say, based on the preliminary results of ozonated autohemotherapy at the hospital in Tianjin, the clinical effects are positive and rapid, especially for the critically ill patient whose lung tissue damage was effectively alleviated. And then there's also an interesting information here. So here, this is a very interesting blog with some very interesting articles by Bit. Oh, hold on a second, you guys can't see this. Just a moment. Let me fix this. Okay, let me show you. No. Okay, I wanted to show you my computer, but I cannot show you my computer for some reason. I don't know why it's not working. Okay, this is unfortunate. Oh no, you can see it. You can see it now. You can see it. Okay, right. So this is a blog by Ben Whitmore, and here he lists a number of clinical trials. So whenever you start a clinical trial as a hospital, as a doctor, you of course needs to file an application for this, because it needs to be all done ethically, and certain standards, scientific standards, need to be adhered to. And here it says that you see on February 2010 in Haihei Hospital, Tianjin, a clinical trial has been started with ozonated autohemotherapy on 30 controls. With 30 controls, so 15 severe patients and 30 controls. So this is definitely happening in China as well. And here you see there's also Spain is also mentioned. This is also a clinical trial that started in April. And so in Spain, Valencia, and this is also a second place in Spain. So one place is Spain, Valencia, and the other place is this Ibiza. This is probably the hospital that I mentioned before. So there are 2 different clinical trials happening in Spain right here. And also a very interesting thing, so this is something that the Italian Society posted on their Facebook page. Here in Iran, a randomized controlled study is happening and has started in April 23rd on 80 participants, and they were also planning on using major autohemotherapy with a concentration of 35 micrograms per milliliter. So you see, so we have here, so this is Italy, this is China, Spain, Iran. So they have officially started clinical trials with ozone therapy on coronavirus patients. So by the way, thank you very much for Ben Whitmore. He has some absolutely excellent articles on ozone therapy on his blog. All right, next up, what do we have? No, this is not what I want to show. Okay, we had China. Okay, sorry for the wild scrolling. Okay, here some more interesting things. Okay, Germany, by the way, in Germany, so some people were speculating that maybe Germany is using ozone therapy for coronavirus infections and that this may be accounted for the low mortality rate in Germany. Well, this is not the case. As some of you may know, I am actually in Germany. I am German, speak German, read German and everything, and I could not find a single piece of information that anyone has used ozone therapy in Germany for coronavirus infections. Now again, it's possible that single doctors in the private practices have done so, just like in the US and just like most likely many other different countries, but no one is publishing anything about this. They haven't even published the news about what's been happening in Italy. This is also something that's seems to be completely unknown for the Germans. But Romania, so this is another European country. So a Dr. Gabriel Margos, who is the vice president of a Romanian Ozone Therapy Society, he gave an interview on TV and he says that he's seen very promising results on COVID-19 patients with ozone therapy. And by the way, he called ozone therapy a virostatic disinfectant. And some of you may be aware of the hoopla of the scandal that ensued when Trump proposed that one could inject COVID-19 patients with a disinfectant, and some were speculating that he could have maybe possibly meant ozone therapy. And here we have another doctor calling ozone a virostatic disinfectant. So given that his ex, Marla Maples, that she actually was treated with direct ozone injections, as we know through people who are in the know, who are also members in the Ozone group on Facebook. So she received DAV ozone injections for Lyme disease, and she is still connected to Trump. So maybe they talked about this, and maybe this is what he was talking about. We don't know. But anyway, so in Romania they have also started treating coronavirus patients with ozone therapy. Okay, one of the most enthusiastic reports comes from Peru. This is a country in South America. And there, Dr. Carmen Cabrera, she has published something on Facebook, and she says, basically, okay, the title of what she published says, ozone therapy, the best treatment for COVID-19, do not hesitate. I mean, could it be any clearer? So what she says, what happened at the hospital that she's working at, what seems to have happened is that they had a gathering with all the doctors from different specialties, and they wanted to find out what the most effective treatment for coronavirus infections was. And she says that something that kept coming up and something that they all agreed on was ozone. She says, and the only thing that they have not objected to is ozone. So from Wednesday at the latest, they will give us an area and all hospitalized patients will receive it. So it sounds like they wanted to dedicate a whole ward, a whole section of the hospital only for coronavirus patients, which would be treated with ozone therapy. So this is also something super exciting. Another report was from the country of Georgia. Now let me see if I can find this. I think this is this here. So I used okay, it doesn't display the picture for some reason. So I used Chrome translation option. And so Tengis Servatze, so this is the head of infectious disease hospital. So this is a Georgian doctor. He says that ozone therapy has been used on 4 patients in the country of Georgia. 3 viruses disappeared on the 7th and 9th day. And 3 viruses, I'm not sure what they mean. As I said, this is a Google translation. But yes, so this little country, this is a tiny country in Europe, in the Asian part of Europe, they also have been using ozone therapy. Okay, there was also a small report. It was really just a screenshot from Chile. They also said that they treated successfully 2 coronavirus patients. So this was another case, it seemed, where private doctors just took it upon themselves to try ozone therapy. In Brazil, they passed in the parliament. They approved in one part of the parliament this bill which would have authorized authorities or doctors to use ozone therapy on COVID-19, but since then we haven't had any news, so we don't know where it's at. But we heard from a nurse from Brazil on who ozone therapy was used, who was COVID-19 positive, and she posted about this on social media, and then she got into trouble from the authorities in Brazil. So it appears that in Brazil this is a little bit more of a delicate issue, and that they do not look at ozone therapy favorably as of now. Then we had another doctor practicing Ecuador, Dr. Juan Burbano. He also gave an interview, and he said that he treated an incredible number of 287 patients with a combination of ozone therapy and interferon, and he saw amazing results. So this is here another comment that somebody left on my Facebook page, and this is someone from Turkey, and he said that we have nearly 1,000 doctors performing ozone therapy legally in Turkey, but our science committee does not know anything about therapy. So it also appears that Turkey is another country where private ozone doctors treat coronavirus patients in their practices, but without a clinical trial that has been submitted or started. Then we also have reports from Mexico, or at least one report, and Argentina. So yeah, those are pretty interesting and exciting things. So it appears that Italy, Spain, Iran, Ecuador, and Peru, that those are the countries where ozone therapy has been used officially and on a wider scale. So in hospitals, on coronavirus patients, and many of those doctors who have treated the patients, they really give absolutely ecstatic reports. So the doctors who have seen ozone therapy work on coronavirus patients, they use words like really superlatives. So they say very encouraging results or stunning. Or this one doctor in Peru says, do not hesitate, ozone therapy is the best treatment for coronavirus infections. So this is really great news. On the negative side is that what happened to Dr. David Bernstein, he and it appears many other doctors in the US have been contacted by the FTC to stop making claims about alternative therapies helping with coronavirus patients, and there has been some censure. YouTube took down this one video from Larkin Community Hospital. Dr. Brownstein purged his YouTube channel. So it seems that in the US there is some movement exactly opposite to what's been happening in Italy and Spain. But let's hope that this will not result in some bigger backlash after this crisis is over. So this is it for now. Just check out my blog, just check out my article. I will link to it in the description, or probably already linked to it. So if you want to check out all the sources and read the articles in the original, as I said, some of them have been already taken down, or some of them can be actually found only on my blog post. For example, that letter from China, I think no one else has this letter. So yeah, check it out. And this is it. This is it for this live broadcast. I think this is really good. I think I speak better and more fluidly when I'm live as when I record it. So I think I'll be doing this more often. Okay, let me check real quick the comments. How to time IV, vitamin C and DVA ozone. So I recommend to do vitamin C 2 to 3 hours after any intravenous ozone application. Janet asks, so it was a one pass? Yes, it appears that they were mostly doing one passes, so major autohemotherapy, which is essentially, yeah, one pass, and they were using ozone concentrations between 35 and 40 micrograms per milliliter, as opposed to 80 micrograms per milliliter, which is used during the 10 pass. JW Penny Stacker, what happens when I use PMF on 500 milliliter vase ozone water? Vase ozone water? I don't know what happens. So you're asking if you combine PMF and ozone, or PMF on ozonated water? I don't know. I've never done this. But then I was ozone IV therapy as a supplement treatment, but patient reported back every treatment she was feeling better. Patient, I believe, was also a retired US nurse. Okay, this is great. Oh, so Bogdan, are you reporting about a coronavirus patient who was treated with ozone therapy? If I understand correctly, if so, this would be awesome. Disappointed in Seattle. I was hoping Germany was attacking corona with right. Yeah. That's really weird, right? That Germany, because apparently, so according to some, Germany is the birthplace of ozone therapy, and yet, like, there's absolutely nothing happening about ozone therapy in Germany, like none, zero. I checked Facebook, I checked YouTube, I just Googled it, nothing. As I said, they didn't even report in Germany about the hospitals in Italy that have been using ozone therapy. So this is it, guys. Thank you very much for joining me, for tuning in. And yeah, if you want to schedule a consultation with me, you will find a link to this below the video. Again, thank you very much for watching, and see you in the next one. Bye bye.